Welcome to another edition of Emerald TV. This time around, we are here for another very sensitive spiritual and health topic. But with me today, before we dive in, I have before me a nurse and a man I will call a pastor. Yes, he's a man of God, and here is a nurse with me here. Nurse Promise Osabuhen and Mr. Emmanuel Idude. We're going to look at this topic very seriously and we'll dissect it. We'll look at prayer, faith for healing, and then mercy. We'll not strike a balance. Is it when somebody has some kind of illness or fall sick, should we resort only to prayers and then believing that we'll get healed? And then the medical doctor may say, no, it's not so. You will need to take drugs. I remember I was in a village in Edo State, the place called Sanfobidara. Some years back, I remember a little girl, she was a bit sick. And then the mother prayed for her. Having prayed for her, she told the young girl, say amen. The girl said amen, but give me paracetamol. That's what the girl told the mother. He said, but having prayed, and the young girl said, he said, no, but mommy, give me paracetamol. That means the girl wanted to have prayers and also collect the drugs. So, from your point of view, where do you think we should stand? Should we only, somebody is a bit is sick, should we just resort to after praying, just forget taking drugs and then live your life like that and wait for God to take care of the head?
Okay. Prayer is good, and at the same time, taking drug is good.
Explain to us.
Okay. When a person is sick, the first thing is you take drugs and you allow the drugs to work. If there is no positive response from that drugs you took, then pray. I believe prayer is stronger and better than the drugs you have taken. So prayer is good, but at the same time, the drugs is good. So
now, I'm sorry, but there are some pastors that will tell us that whenever you go and see them, I'm sick, daddy, I'm sick, or you say, pastor, I'm sick, they will tell you, they will say, just go on your knee and pray. And they will say you pray, and then to them, as far as they are concerned, just pray and God will take care of you. What do you say about that?
It depends on the level of the sickness, depend on the type of sickness. Though prayer can answer, God can answer every prayer for any kind of sickness, no matter how high, no matter how big the sickness is. If you pray, God can answer. But don't underestimate the impact of the impact of medicine or medical treatment. Don't underestimate it.
Yes, Nurse Promise, you are in the medical, and I believe that you must have helped in treating some persons, or you have given drugs. And by the grace of God, you are also a Christian. And then you go to church too. Now, somebody is sick, and then the person is just there, and then the person is a Christian. You tell you are prayed. That's what I prayed. And you want to give him drugs, but you tell you are prayed. What do you think?
Okay, when a patient does that in the ward or in the hospital, what I do is that I explain what that drug does for you. I explain the drug to you. I will tell you that this particular drug, when you take this drug, you're going to feel better. Of course, you're going to pray. When you pray, you believe that yes, this drug is going to heal you. So I normally act with their faith. So I'll bring in that faith with the drug. I will tell you, take your drugs and have faith, you will be fine. So that's what I do whenever I'm experiencing patients like that.
Okay, that means you tell them to blend
I tell them to blend it.
both prayer
Yes.
and taking the drugs.
Yes, because people do believe you when you miss prayer and medications and everything.
Not just only say, no, just take there are some people who say, I bet leave prayer. And leave prayer, just take your drugs, and you okay. Anything like prayer, just abandon it. Do you agree with them in that direction?
Like I said, I work with your faith. And I work with what you tell me. If you tell me that you are atheist, you don't believe in God, I say, okay, no problem, you take your drugs. And make sure you take your dose and take your drugs.
Now, some persons believe that as far as they are Christians, they cannot be sick. Do you agree with such belief system?
No.
Why?
Because sickness, let's just be factual here. Sickness, ill-health, pain, they're all part of life. It's a natural phenomenon, it happens. It's not something you can run from. It's not as if nobody's praying to be sick, but yet we do fall sick. Let's be factual. Nobody wants to die, but people die. Nobody wants to go through some certain things, but they will go through that because it's a normal phenomenon, it's a part of life. So you cannot say because you are a pastor, you won't take care of your health. You will take care of your health. If you are sick, you will take drugs. You will pray, but you will take drugs. You will take your drugs so that you can get better. So that idea of saying praying and actually not working, you're actually killing yourself.
Now, for your end then, what then is the essence of praying when you are still, is that not a issue of unbelief? You have prayed. Oh no, you have prayed already. And then you still add drugs to it. If you believe, why missing it with drugs again?
Even the drugs itself is like a powder. So without your faith, that drug will not work. So there are times you are taking the drugs in, you are taking the treatment, you are prayerfully taking it in. God, these drugs, I'm pleading, please let it work. You understand? There are some
Yes.
heard of issues where people will take drugs and at the end of it, the drugs will not work, the sickness will remain there, and all of that. So prayer is something you cannot do without. I still repeat it. Prayer is something you cannot do without.
Now, on your part, no, sir, there are times people will pray and then take the drugs. But the sickness still persists. You might have experienced, you have seen somebody, or even a person, you have experienced that, or you have seen some person, they pray. As much as they will say, I prayed. Some will say, I've gone to all the hospitals in the world, within my jurisdiction also. But the sickness still remains. What do you think lead to such things?
Okay. So for me, what I understand with that fact is, even we doctors and nurses, we do pray too whenever we are trying to treat patients. So when a patient takes a particular drug and you tell you've prayed, first of all, faith, like he said, faith is actually very, very powerful. So once someone takes drug that is on that, what actually happens? So that they can rule out. When you say doctor, you do a test so that they can rule out what is causing you not to heal. There might be something hidden at you. Maybe you are treating the basis, you're not really treating what is actually happening. So you go and see a doctor so that they can rule out whatever is wrong with you, and you go for another treatment. You understand? And for the prayer aspect, is that prayer without faith won't work. So once you take your drug and you say, and if you don't have faith, and the kind of faith I am talking about is not that you just pray and just pray, say you keep praying for one thing over and over again, you keep praying. That's not having faith. To me, personally, I don't believe that's faith. I believe that when I pray for something, God has answered, and I stop praying about it, and I actually go and I actually do the actions.
What about if the symptoms of that illness are still there, and you are praying, and the symptoms are still there, and you say you are praying, you believe, but the symptom of the sickness is still there in your body? What do you now do?
Go to the hospital and go see a doctor and go for a checkup. That's what I tell you.
Okay, Pastor. Let's look at your end again. We're in a church,
Yes.
and then your members, they are there. They are some of the one or two of them sick, and then you have prayed for them, and then you are praying, but it's like you are not how you call it, you are not seeing the fruits of your prayer. These are possibilities. What will you do? Will you continue praying or tell them to go to hospital when you know that your prayer will take care of them?
Faith without work, Bible said, is dead. So, if faith without work is dead, then a wise pastor will advise his or her member to go to the hospital and do proper checkup, carry out the test, know where the problem is, know what the problem is, then attack the problem directly. Then if it is a spiritual problem, then we know we resolve back to prayer and we fire it with prayer, and then we believe God that God will answer.
Now, are there some sickness you think that prayer cannot answer, cannot take care of?
Prayer can answer, prayer can take care of everything, every problem, every sickness. But why troubling God? Why praying and praying and praying when you know this is sick, maybe let's say malaria, and this malaria came as a result of mosquito? Is it not better you go and treat that malaria?
No, but you say why troubling God? God is your father.
Yes.
Eh?
But there are
And
some
he
things
says,
you
call
do.
upon me.
I
You
will
are
answer
trouble, I
you.
will answer you.
Yes.
So praying and continue to disturb God. And you are currently troubling your father. How is it troubling your father?
What I'm trying to say is,
Yes.
in essence, is the area of praying and praying when you know the right thing to do.
What is the right thing to do?
The right thing to do, as for example, now you are ill and you know this is malaria and you have mosquitoes in your area. You know this malaria is caused by this mosquito all over. It is now your responsibility as a Christian to go to the hospital, take treatment, and fleet your environment to avoid mosquito, and then treat yourself. Not that you know the solution is in your hand, you know the solution, you have the solution, you are still meeting God. There are some things God will do, there are things God will allow you to do. That was why He gave us wisdom, that was why He gave us brain to think and to put things right.
Yeah, and you made a point, The point you made is that there are certain things we don't need to disturb God for.
Yes.
Like you said that, like
you are not making use of that phrase disturb.
I think we need to disturb God for,
Yes.
like your environment now, that you know that when mosquitoes are there, net your house.
Yes.
Then fleet the house, so the mosquito will be out of the house. But instead of doing this thing, you allow mosquito to bite you. Mosquito will feast on your body. Next thing you fall ill, malaria comes, other things come, and then the next thing is that you are having malaria. Then instead of these are things you can easily take care of on your own. Instead of without even that are not supposed to lead to being sick in the first place. So people that are in such situation, people that behave like that, what do you tell them? Now the people that allow their homes to be infested and allow malaria mosquito to bite them, what do you tell those persons?
My simple advice, though I'm not a medical person, but my simple advice is clean up your environment, net up your windows, and treat yourself.
Yeah, let me come back to it now. Just like the question asking, some people expose themselves to things that lead to such ailments. What do you tell such persons from your medical perspective?
Exactly what he said. Take care of your surroundings, clear your compound, put mosquito net on, fleet your house, make sure that at least in your house you are free from mosquito bites. So take care of your surroundings and everything. So everything that he said is spot on. The fact you pray doesn't mean that you will take care of your surroundings every day. So it's the same thing he said. Take care of yourself, take care of your surroundings. If possible, get mosquito repellent sprays, mosquito repellent creams on your apply on your leg, cover your body. Even if during this rainy season and everywhere is cold, you can also take on wearing shoes, stockings, and wearing clothes that cover your body in order to prevent mosquitoes at all costs. So I always tell people to do their best in protecting themselves.
So from your point of view now, if I get two of you right, two of you are already standing on almost the same point.
Yes.
Prayer should be taken. Why also we should also
medical
take
advice.
as drugs.
Yes.
That means both of them should be run on equal basis. Am I correct?
Yeah, I want to ask you a question.
Okay.
You mentioned spiritual. Well, let's when it's spiritual. Let's talk about psychiatric. People in psychiatric hospitals. Mainly in churches, we do believe that madness is spiritual, but in terms of medical terms, it's not. It has a meaning. It's called mental disorders. So you said maybe when a person is experiencing schizophrenia or bipolar disorder, you say the person has demonic spirit and you want to deliver the person. Fine, you deliver the person and the person is not well. Will you keep delivering the person or you tell the person to go to a psychiatric hospital for treatment?
No, sorry, you mentioned if I said demonic, there are some medical terms you mentioned. Please explain them to us. Schizophrenia or what you call it?
Schizophrenia, like when someone has schizophrenia, it's a very terrible thing. Like the one I'm very, very used to with patients when we've been posting them, when they paranoid schizophrenia, you see them start blaming you for something you did, maybe they can start blaming you. You can see someone start blaming you for the death of their mother, you know. They start sometimes they be talking to themselves and acting rational, start screaming, you know. So that's what it means. I'm just trying to make it easier to understand. So when you see somebody acting that way, of course the person has a mental problem. And you as a pastor, you see this person, will you just only pray for the person and tell the person to go, or you pray and tell the person to get treatment from a psychiatric hospital?
Yes.
I told you before that the place of medical assistant is not ruled out. The place of medical assistant is not ruled out. In such a case, you can, or as a pastor, you should send such a person to a psychiatric hospital where the doctor will do a checkup and know the problem, and then the problem will be solved.
But not everyone thinks like you know that, right? You might be logical now, but there are a lot of like our elderly pastors. I've met some of them when they see some certain things and they just believe that just prayer alone will solve it. Like I have seen. So you might be acting logical right now. Think on the base of maybe you are elderly and it's a bit old school. So how will you handle such cases if you're in that stage?
Yes, that is where ignorance comes in.
Yeah.
When a man is ignorant, he walks in ignorance, and every of his action will go in line with that ignorant mindset. So, as somebody who knows the right thing to do, you send the person for a psychiatric test and checkup and all of that, examination. Then treatment will commence.
And also, what of if maybe, because right now we are talking about treatment and it's a lot of things that actually entails in going into, this treatment we are talking about. Let's go deeper. Maybe youths are mainly one of the issues that we get when it comes to what I'm trying to say. Maybe there's a particular person, this person takes drugs and alcohol and all those things in order to escape depression, stuff like that. So the person got addicted to it. So the things that are affecting the person. As a man of God you are, what's your advice to such a person and how can we help them without stigmatizing them?
I don't really, okay. I think if there is, I always fall back to the place of medical attention. If there is a medical solution, then fall back to that medical solution.
Now, you know what, let me still put something there. If I understand your question very clearly, like some of these youth that take some drugs that affect them mentally, and you see that some of them start rolling on the ground and then misbehaving. and how can you help them without getting them being stigmatized, okay?
Yeah.
Now,
I was asking if it's just going to like pray, you know, they will do the universal, they will go and deliver you. Are you going to just deliver them, or you're going to take them to the hospital to get rehabilitation to control the addiction?
no, if I may add something before I continue from there, sometimes you pray.
Yes.
As a pastor, you pray.
Yeah.
Having prayed for them, you have done your part. But that prayer alone may not completely settle the entire problem. So that should lead to maybe the rehabilitation we talked about. All these are necessary. But sometimes some of our pastors, with their knowledge of, with their kind of
The level of
level
they feel a level of spirituality.
Yeah.
So you see them just say pray, whereas the prayer alone may not completely solve that problem. So within
Yeah,
it.
even with the extent of when somebody is bleeding, maybe someone has what do you call it? Cancer of the ovaries or the ovarian cancer caused by a long term of untreated HPV. You understand? So someone can have such a thing, even fibroid. A lot of women has issue with fibroid, PCOS, and all those things. Maybe they'll meet their mother-in-law and or their father-in-law, the pastor, and the pastor will tell them that let's pray about it and we'll not do the surgery, we'll not remove it, and they will believe that yes, they are healed without actually going for medical checkup to come to check up. So when you meet such people that actually believes in your prayer without actually doing anything to actually help themselves medically, what are you going to do in such cases? Because sometimes your members also can be adamant. So as a pastor, what are you going to do? And how are you going to advise such patients or such people?
Okay, let's say when you talk to such members, they believe.
Yes.
They believe
as
your
a
word as
pastor.
their father in the Lord.
Yes.
And you will try your best, you still talk to them, tell them, advise them to go for medical treatment, medical checkup.
Now, you know what, if I may add to that again, we have seen some cases where some people stood their grounds.
Yes.
They will say, even the doctor will tell them, this is what we want to do. Some may be the hospital, they will say they want to do surgery on them. They will say no, they don't want to go through the surgery process. Even some that are going through delivery, they will tell you they want to do the delivery through CS. Some will say, you say no.
They want to deliver like the Hebrew women.
They want to deliver
like the
as
Hebrew
normal women. Even some that are very sick like that, doctor will say, let's do this thing so you can be fine. They will say, no, I remain like this and I believe God. They will pray. We have heard of such instances. And truly, they got their miracles. So some of those instances exist.
Yes.
They do exist. And they have seen miracles like that. People just say, they are standing, they pray and they believe God with their mind that this thing will happen as a miracle. And we have seen such happen to them without paying such bill for medical, for surgery or whatever. Those things do exist.
Yes, it do exist. It do exist, that's true. I've heard of miracles of people who are having serious fibroids and they want to die. And they just believe that the prayer works and it works. Like I said, faith is a very powerful thing.
Sure.
Yeah. So when you pray and have faith too, it works. But also it's also good to listen to your doctor.
So it's very good research, your doctor.
That
Very
has
good.
killed people out of negligence of health. Like I notice in church today, like a lot of people are so negligent about themselves. They don't even know what's happening in your body. You understand? So you say, I'm strong, I'm serving God, nothing will happen to me, but yet you don't check up, you don't check. You don't want it, you don't do anything, and I'm just hoping that God. One day your body's going to break down since you don't check.
Now, as a medical personnel, do you see that brainwashing from some pastors?
Yes, it's brainwashing from pastors. It's still some brainwashing from pastors because, like, according to me, most times when I'm talking about things like this, I normally talk from experience because that's how I can relate with people. They'll like sometimes, my dad is a pastor, everyone knows that. So there are days that I'll be very ill and he'll pray for me, fine. After praying, that your prayer, oh, I need to go and run a test, I need to get better, I need to take drugs to actually get better. So I don't just, I accept the prayer fine, but I take precautions after that prayer and make sure that I'm okay. God can perform miracles, yes, but you need to take precautions.
Now, do you see that as out of faith?
It's out of faith too, because sometimes you take drugs and it won't work, right? So that I use that prayer as a way of a power as a power to hold myself and say, when I take these drugs, I'll be fine and I'll be fine.
Okay, thank you very much. We have listened to our medical personnel here and our pastor Emmanuel today. Now, we have been able to strike a balance. If you have followed us from the beginning of this interaction, both of them agree that prayers are necessary. At the same time, taking drugs are also important. They agree that there must be a balance. They also agree that when situation, like the pastor here agreed that when situation become critical and the prayer have been made and the illness still persists, there is the urgent need to seek medical attention. And the nurse also believe that prayer also goes together with the drugs.
Yes.
Do she be a medical doctor? She's not saying that you should only take drug and need prayer. Both of them must go together.
Yes.
So for your end, you must understand that you are a Christian, you are a bishop, any name you bear whatsoever, you should understand that your head is important. You should see as you should treat it as of something very paramount to you. If you only rely on prayers, beautiful. There are some people that live from the beginning of the year to the end, they don't fall sick. They are doing fine. That is beautiful. But when there is need to go and do tests, please do tests. Check your BP, check your blood sugar. Make check so that you are running, not that one day people will just hear that man is falling. He just walk somewhere between the next 2 feet he walk, the next day the man is down and they pack him and then it's off the line.
I like to add another advice to
Yes.
I want to also add advice to the young generations as well. I know there's stigmatization concerning a lot of things according to these infections we are talking about. A lot of people are ashamed to come out to actually say they want to go and do these things. Always make sure to check yourself, go and run tests, because all these things has actually caused damage to your body as a person. So always try your best to run tests, run infection tests. Very important. Both I'm talking to both male and female. Always try your best to run that test too, because that it doesn't mean that you're not doing some certain things. You're not going to do that. You're supposed to run tests so that you make sure that you are fine and you're healthy.
It was promised. Thank you very, very much. You explained to us what we should do to take care of our heads. And you also told us why Christians should also pray. That we have agreed that both of them must work together so we can become healthy both spiritually and health-wise. And every part of ourselves will be fine. While we relate with God and man, we will. So please, those of you that are out there watching us, listening to us, let's hear your view. Do you really rely on prayers or rely on taking drugs? What do you stand for? I remain Austin Oyewole, the host of Emerald TV this time. Thank you and God bless you.